this is Dr. Giudice, the Clinic Director of Larchmont Wellness, with part 2 of building immune system health. As we start to think about going back to school, it takes time to build up a fully functioning immune system. We don't want to have a replay of what happened last year with people getting sick multiple times through the cold and flu season. And as we mentioned in the last series, there's different components of the immune system. And I don't want to give everyone all the data on what strengthens Th1, Th2, because I, to some respect, don't want people to go rogue, because if you already have an out-of-balance system, you could certainly push it the wrong way. So I want to talk about some of the safer things that you can do. So in this first part of the immune system, which we'll call the innate immune system, and that's that one, again, that starts to kick in within a few hours to up to 2 days when we start to have a pathogen or virus, bacteria come into the body. That's what kicks in. One of the main things that you need for this is to have adequate numbers of white blood cells. And when you look at your CBC, which is your complete blood count, you'll see a pretty wide range of what normal should be. But when I look at a CBC on people, often their white blood cells are kind of at the low end of normal. And I know at that point that they don't have a fully functioning innate immune system. So there's various things you can do to support this system. The first thing that I'm thinking of is folate and B12. Folate, which is vitamin B9, and B12 for cobalamin is vitamin B12. You need these to make red blood cells, but you also need them to make white blood cells as well. So if you're not already supplementing or don't have a diet consistent with having adequate numbers of folate and B12, and even in kids are often deficient in these things, and some people have genetic defects where they don't absorb these things very well, it's critical to make sure we're taking folate and B12 for a long enough period of time to have an increase in our white blood cells. And it could take 120 days in taking this and to have adequate numbers of white blood cells. So that's the first strategy I want people to start thinking about. There's other things you can do to strengthen the system, the basics, vitamin C and vitamin A, and probiotics will support many of the different immune system pathways without getting too specific on the types of probiotics. So just understand that taking a probiotic will support a lot of these different pathways. But this is the place that I would start already. If you don't know which ones to take, you certainly don't want to take a synthetic folic acid. It's not very well tolerated by the body. You want to start to either take a food state or an already activated version of these two nutrients here. If you have any questions on these things, just give us our office a call or send an email in, and we look forward to seeing you.